Hi, I'm Kat,
And I'm Ty.
and we're with the AIDS Awareness Committee.
And today we're going around asking the top 10 questions about HIV and AIDS.
Let's get started. All right, so we're getting ready for a student to walk out. Hey, excuse me. Do you have a second?
Yeah, sure.
All right, well, we're with the AIDS Awareness Committee asking students what they know about AIDS. So I want to ask you, what is HIV and AIDS?
Well, what I know about it is that it's a sexually transmitted disease, and it lowers your white blood count. Yeah, I think that's it.
Cool.
Yeah.
Cool. All right, well, this guy here is actually pretty correct. AIDS, or HIV, stands for the Human Immunodeficiency Virus. It is a virus that infects your white blood cells, taking over them like a parasite and using them to reproduce. AIDS stands for the Acquired Immunodeficiency Virus. And basically, AIDS comes from the virus of HIV. It infects your white blood cells, making you more susceptible to getting things like pneumonia or other illnesses, and that can break down your immune system. So, all right, thank you.
Thank you.
All right, so we're with AIDS Awareness Week.
Okay.
And we're asking the top 10 questions. And this question for you guys is, how does HIV work?
It attacks the cells in the body, hurting the immune system.
Alrighty, that is a good answer.
Yeah.
They're actually really right. It does attack your white blood cells, which attacks your immune system, which causes, and do you guys know that you can't die from AIDS? Like, AIDS is not what actually kills you. It's the other illnesses and illnesses you guys can catch to kill you. All right, thank you guys.
Cool. So, do you know how HIV is transmitted, or if other STDs could affect how you're affected by HIV?
From as far as I know, you can transmit it by sharing a needle. You can share it by even by doing like oral sex. You can have it by what's the term you say? Like I heard that you can get it by kissing too, and then there's like a lot, but I can't really think of it.
Actually, you're really correct, actually. HIV is transmitted through bodily fluids, such as blood, semen, vaginal discharge, even breast milk from people who are pregnant or just have kids. So you cannot get it from kissing, hugging, sharing eating utensils, sharing food, even mosquitoes, fleas, any bugs. You can't get it from that stuff. The biggest thing is sharing body fluids, such as blood and semen. And then as far as other STDs go, they do affect you having AIDS by the fact that you might have open sores or something from the STD. So be careful when you have an STD and are having intercourse. Thank you so much for your time. We really appreciate it.
You're welcome.
Do you know how you can be safe and not getting AIDS or HIV transmitted through sexual intercourse?
Well, I guess, obviously no sex, but using a condom, knowing whether or not your partner has it, so that way you don't pass it on to future partners, for sure.
You're absolutely right. The way you can make sure you protect yourself is use condoms, especially latex condoms, dental dams, and using waterproof only lubricant. And definitely make sure that your partner does not have HIV. Thank you for your time.
No problem.
Hey everybody, it's Kat again. We're here at the Ink Pusher with Greg, the owner, and one of the artists here at the coolest tattoo place in town. So we're here to talk about being safe with needles and basically if you go to tattoo, what to look for to make sure that you're HIV safe. Greg, if you want to.
Hey everybody, so what we'll do is I'll show you guys what to look for when you're about to get a tattoo or a piercing. Why don't you guys come on back. If say we're getting ready to start a tattoo or a piercing, I'd go ahead, I'd wash my hands. You'd go ahead, you'd put some gloves on. And things need to be wrapped. The bottles, because see you'll be touching things like this, or the tattoo artist, I should say, will be touching things like this. This is alcohol. This is green soap, which is used throughout the entire tattoo, still wrapped. This way you're not cross-contaminating any blood, any of the bloodborne pathogens. Everything, tattoo tubes, tattoo needles, they all come in sterile pouches in some fashion. Something else you can look for And feel free, not everybody asks. I mean, this is good, seeing things getting tore open out of a sterile pouch, but there's indicators on the back. Mostly you're looking for the top one. This one happens to be pink. It changes to brown once everything's been processed properly. The bottom one isn't anything you have to worry about. As long as it's been processed, usually you can see the steam kind of change. It's not so perfect like that. The tattoo cord, because working on the tattoo, various parts of the body, this can drag through the person's body. So if it's like that, and say they're bleeding all through here, you wouldn't want the cord, you want the cord wrapped, I should say. You don't want this cord dragging through every person that comes through here. Once I have the tube in here and the needle all hooked into the machine, this will actually get bagged. There'll be a bag over this also, so none of this will be touched. The tube's sticking out of the machine. So what I'll do, let me get this hooked up. And all this is going to be hooked up while the gloves are on. So then you can see, this will all be bagged. This way when I'm down here, I can tattoo away. This way none of the blood transfers up into here. Not that blood splatters or anything, but this is still a good thing to have covered, because what if you decide to set it down here or anything like that while you're working? Piercing, same thing. It's going to come in a little, same thing, sterile pouch. Something else, something good to ask is if they use new needles on every client. That's very important. With piercing needles, since they're hollow, it does take out a part of the skin. You definitely don't want that jabbed through your ear or any part of your body part for that matter. When they're done with the needle, they'll grab it, they'll put it in a sharps container. It typically looks like this. There's various bigger boxes. Some are like you see at the hospital. These boxes go into another box that is actually locked. Okay, I've been tattooing. These gloves are now dirty, used on the body. So at this point, let's say I need some more red. You're going to have to take the gloves off. Little disposable ink caps that they would pour the ink into the bottles, and all this can be thrown away. Like when I'm done with cleanup, I'll take everything, wrap it all up, and just throw it away.
So one final question for you. What is one thing a person should look for when they're entering a tattoo shop?
Generally I would look for the general vibe you feel at the tattoo shop. Does it feel like it's a clean place? Do you get a good vibe? If you get some horrible vibe, probably leave. Your instincts are always right. Something else very important is preventing disease transmission, bloodborne pathogens certificate. Every tattoo artist in every state has those, so they should have to have those.
All right. Well, thank you for your time today. We really appreciate it.
Thank you.
Thank you.
Have a good day.
You too.
Hello. So the question today is AIDS attracted to one group of people?
No, it's not.
All right, that is an absolute correct answer. AIDS is not discriminated towards any certain group. Women are more likely to get it than males through vaginal sex, through open sores. Just remember to practice safe sex and you will be okay.
Okay.
I just have a quick question for you. Yeah, no worries. You're not punished if you don't know. So, all right. Do you know if there is a cure or treatment for HIV and AIDS?
Right now there's no cure, but they are doing new experimental research because one man was found to be somehow he was immune to the virus, or he had antibodies that were able to fight the virus. And this is kind of more lately, I think, but I don't think there's any cure per se.
She's absolutely correct. There is no cure for AIDS. And the treatments that we have, while they do combat the HIV virus and actually can probably get your blood system about back to normal as far as the immune system goes, there's still no cure for it. And those drugs that do help treat it actually harm your body as well. And also, on top of that, the AIDS virus mutates very quickly. So the treatments that you're receiving now may not be affecting you in 1 to 2 years. So, all right. Thank you for your time.
Do you have a second, sir?
Yeah, what's up?
Well, we're with the AIDS Awareness Committee and we're asking questions about AIDS, HIV and AIDS.
Okay.
And the question I'm going to ask you is there a vaccine for HIV and AIDS?
As far as I know, I don't think so.
You are absolutely correct. There is not a vaccine. They are doing intensive studies on it, but by the time the studies go through, it will not be cost affordable for everyone. So really, there's not a chance we're going to get the vaccine. Thank you for your time.
You're welcome.
Do you know how to get tested for HIV or AIDS?
I go to a clinic.
Right? Yeah, she's right. It's as simple, getting tested for HIV is as simple as going to your local clinic and getting tested by your doctor. They also have a really cool take-home kit that is FDA approved. It's called the Home Access Kit that you can buy at your local drugstore. So, thank you for your time. So, what can we do to help the fight against AIDS?
There are many things you can do to help the fight against AIDS. Just here are a few suggestions.
First of all, you can help your local AIDS awareness organization, such as the AIDS Awareness Committee here at Adams State College.
You can also host a fundraiser around your organization and on your campuses to help raise awareness.
Also, fight against AIDS-based discrimination and urge your local government officials to raise the amount of funding that prevention and research get for AIDS and HIV. Thanks for watching our video.